Hi, Dr. Paul Coleman here, Coleman Center for Cosmetic Dentistry, with this week's edition of Dental Health with Dr. C. I'd like to talk about a subject that you probably all think you know something about, and it's veneers. What are veneers? A veneer is a piece of porcelain that's fabricated by a lab that bonds onto your own tooth structure. And the advantage of veneers over perhaps the traditional crowns, with a crown you really need to reduce and amputate a lot of healthy tooth structure. With this, we basically just have to reshape some of the enamel on the front so we can put porcelain where we need to make it look good. And these things can be darn thin, 1/2 millimeter in thickness. It's analogous to having a fake nail bonded on maybe a stubbly broken up one if you have to go to the salon. But these things are made by master craftsmen and just bonded onto the tooth, and they will create what I and the patient dictate we're looking for. So there's a whole bunch of things that go into a proper veneer case. First thing we have to decide is, how many do you do? Well, I generally have a patient pick up a mirror and hold it and smile. Count teeth. Well, if you're going to go with a real light colored upper front teeth, you probably don't want to just do 6 as a rule, because someone is standing over here looking at you going, what's wrong with those 2 teeth I'm seeing from the side? So generally, to do a case right, it's an 8 to 10 tooth case. That being the case, I've done a lot of 4 tooth cases or 6 tooth cases for people, but invariably I'll have somebody call me back. I had a lady just a couple of years ago, we did her front 6 teeth, and she just loved them, loved them, loved them. She went on vacation with her friends back to Cape Cod and called me from Cape Cod requesting an appointment. She goes, someone took a picture from the side and I looked at it and I just hated it. When can I get in to do the other 4? Which was fine and made me chuckle because I love saying, I told you so. But that aside, it really works out well for people. If your teeth are crooked, if you have spaces, if they're worn, if they're chipped, if they're broken, veneers are a spectacular way to just rejuvenate the front of your face. Now, the important thing about this is you really have to go to somebody whose veneers are kind of custom made for you. We actually sit down with a smile library and we pick out, because if a tooth has the same correct golden proportions, so all the proportions look right, depending on how you handle the edges of things, you can make a tooth look like it belongs to an older person or a younger person, or you make things a little rounder and it feminizes and softens things. So the same veneer case that I might do for an 18-year-old girl would be demonstrably different than for a 42-year-old guy attorney. Now, they both might look spectacular if you put them in the right face, but if you're making them all look the same no matter who's walking in the office, they're going to kind of look like you had veneers done. Now, my goal when I do this, actually the most impressive thing that comes out of these cases is patients will come in and say, I'll say, what did your friends think about your smile? What did your family think? And they said, well, my friends kind of looked at me and said, did you lose weight? Because they look at you and it's not this glaring piano key, Mr. Ed kind of change. They just look at you and say, wow, looks healthier, looks younger. Did you lose weight? Because they really can't put a handle on it. They just know you look better, which is great for your confidence when you're looking in the mirror and say, damn, I look good this morning. You know, how many of us can say that in the morning? It's a great feeling, to tell you the truth. The other thing we like to get involved with when we do veneers is when we design a case and do a smile evaluation, the temporaries that I have the laboratory make ahead of time for me is a duplicate of what we envisioned for the final run. So you get to kind of test drive your final teeth. So especially in cases where the teeth have been worn down, we want to make them a little longer. Well, that gets a little taken used to kind of look at you and say, wow, I see all these teeth now. They look too long at first. So you get the opportunity to kind of test drive the final product before they're delivered and bonded into place. The other question a lot of people would ask is, how long do they last? Well, I have cases that have been out there 18 years now, 20 years, 25 years, and frankly, they still look pretty good. Do they look as good as the stuff I'm doing now? No, but the materials have improved, and the techniques have improved, and the labs have improved, and my abilities have improved. So if you're going to have this type of investment done for yourself or you're investigating, you really got to go to someone who's done a ton of these things. If you're going to do it right. And whether it be with me or one of the other, I don't know, 2 people in San Diego I trust, you got to find somebody that really knows their stuff. So if you are interested in the potential of brightening up your smile, looking a little bit younger this new year, give me a call. We'll get you in for a consult and show you the possibilities. Because there's nothing that you have in your mouth I haven't fixed already in my lifetime. So give me a call, drpaulcoleman.com, call me at the office, Coleman Center for Cosmetic Dentistry. Thank you.